Autism Spectrum Disorder is an neurodevelopmental condition. Look at this picture, shows that hypersensitivity to sound, EEG findings. Look at this, and analysis, MRI findings. Look at this picture. A detail going on. Introduction. Autism Spectrum Disorder is a neurodevelopmental condition characterized by challenges in social communication and interaction, as well as restricted and repetitive patterns of behavior, interests, or activities. It is called a spectrum because the symptoms and severity vary significantly among individuals. Early recognition, diagnosis, and intervention are critical to optimizing outcomes for individuals with ASD. Definition. Autism spectrum disorder is a neurodevelopmental condition characterized by challenges in social communication, restricted interests, and repetitive behaviors, with symptoms varying widely in severity and impact. It affects individuals differently with unique strengths and difficulties, and is typically identified in early childhood. Types. While ASD is now categorized as single spectrum disorder, individuals with ASD can vary widely in their abilities and challenges. Historically, subtypes included 1. Autistic disorder, classic autism, significant language delays, social communication challenges, and unusual behaviors or interests. 2. Asperger syndrome, milder symptoms of autism. Individuals typically have average to above average intelligence and no significant language delays. 3. Pervasive developmental disorder, not otherwise specified, PDD, NOS, a typical autism that did not fully meet the criteria for other ASD subtypes. Causes. The exact cause of ASD is not known, but it is thought that result from combination of genetic, neurological, and environmental factors. 1. Genetic factors. Mutations in certain genes linked to brain development and function. 2. Neurological differences, abnormalities in brain structure or function, including atypical synaptic connectivity. 3. Environmental influences, prenatal factors such as maternal infections, exposure to toxins or complications during birth. Risk factors: 1. Genetic predisposition, family history of ASD or genetic conditions like Frangel X syndrome. 2. Gender, boys are about 4 times more likely to develop ASD than girls. 3. Parental age, advanced paternal or maternal age at the time of consumption. 4. Prenatal and perinatal functions. Exposure to medications, infections or complications during pregnancy. 5. Low birth weight or prematurity. Complications: 1. Social isolation, difficulty forming relationships and participating in group activities. 2. Educational challenges, struggling with traditional educational settings. 3. Mental health issues, increased risk of anxiety, depression or attention deficit hyperactivity disorder, ADHD. 4. Self-injurious behaviors, in severe cases, individuals may engage in harmful repetitive behaviors. Pathophysiology. The pathophysiology of ASD involves multiple systems. 1. Neuroanatomy, enlarged brain volume in early childhood, abnormal amygdala or cerebellar structure. 2. Neurotransmitters, dysregulation in serotonin, dopamine and gamma aminobutyric acid GABA pathways. 3. Genetics, mutations or deletion in genes like SHYGENE3 which are critical for synaptic function. Below is a step-by-step outline of known mechanisms involved in the development of ASD. 1. Genetic factors. Step 1. Mutations or variation in multiple genes. Example: SHYGENE3, SHD8 and MECP2 disrupt normal brain development. Step 2. These genetic mutations impair synaptic proteins leading to altered neuronal communication and connectivity. 2. Neural connectivity abnormalities. Step 3. Imbalanced nutritional connectivity is observed. Hyperconnectivity in local circuits within specific brain regions. Hypoconnectivity between distant brain regions. Example: between the prefrontal cortex and other areas involved in social cognition. Step 4. These connectivity issues disrupt the integration of sensory, motor, and social information. 3. Neurotransmitter dysregulation. Step 5. Abnormalities in neurotransmitter symptoms including serotonin elevated levels during brain development may disrupt synapses formation and plasticity. Glutamate and GABA imbalance in excitatory glutamate and inhibitory GABA signals affects brain network stability and functionality. Dopamine dysfunction in dopamine pathways can contribute to repetitive behaviors and reward processing deficits. 4. Neuroinflammation and immune dysregulation. Step 6. Immune system abnormalities such as increased pro-inflammatory cytokines, example IL-6, TNF, alpha, are noted in the brains and cerebrospinal fluid of individuals with ASD. Step 7. Microglial activation. The brain's immune cells leads to chronic neuroinflammation which affects normal synapse formation and neural pruning. 5. Structural brain abnormalities. Step 8. Changes in brain structure and volume such as increased brain size, macrocephaly during early childhood due to excessive neuronal growth and reduced pruning. Abnormalities in specific brain regions, prefrontal cortex, impaired decision making and social behavior. Amygdala dysregulation in emotional processing and treat response. Cerebellum coordination and motor impairments. 6. Altered synaptic function. Step 9. Mutations in synaptic proteins, example neurogenes, neuroexins affects synapse formation, signaling, plasticity. Step 10. Impaired synaptic function leading to reduced efficiency in neural circuits required for complex behaviors including language, social interaction and sensory processing. 7. Epigenetic and environmental influences. Step 11. Environmental exposure, example prenatal infection, toxins or stress, interact with genetic predispositions. Altering gene expression through epigenetic mechanisms, example DNA methylation and histone modification. Step 12. These changes further exacerbate disruption in neurodevelopment. 8. Behavioral manifestations. Step 13. The cumulative effects of genetic, neurobiological and environmental factors results in core symptoms of ASD. Social communication deficits, repetitive and restrictive behaviors, sensory sensitivities. By understanding this step-by-step process, researchers and clinicians can target specific pathways to develop interventions and therapies for individuals with ASD. Signs and symptoms. 1. Social communication and interaction. Difficulty maintaining eye contact, limited understanding of non-verbal cues like gestures or facial expressions, preference for solitary activities. 2. Restricted and repetitive behaviors. Repetitive movements like rocking or hand flapping, strict adherence to routines or rituals, interest in specific topics or objects. 3. Sensory sensitivities. Hypersensitivity to sounds, lights or textures. Unusual response to sensory stimuli such as indifference to pain. Diagnosis. Developmental screening conducted during regular pediatric checkups to comprehensive diagnostic evaluation includes observation, patient interviews and standardized tools like the Autism Diagnostic Observation Schedule ADOS. 3. Genetic testing to rule out syndromic causes like Fragile X syndrome. 4. Neuroimaging and EEG. In cases of suspected neurological involvement, nursing diagnosis. 1. Impaired social interaction related to communication deficits. 2. Risk for injury related to self-injuries behavior. 3. Delayed development related to neurodevelopmental impairment. 4. Caregiver role strain related to the demands of caring for child with ASD. Management. A. Medical management. 1. Medications. Risperidone or aripiprazole for irritability, SSRI for anxiety or depression. 2. Therapies. Occupational speech and behavioral therapies. Example, applied behavioral analysis. 3. Nutritional interventions addressing feeding issues or gastrointestinal symptoms. B. Nursing management. 1. Create structured and predictable environment to support communication through visual aids and alternative communication devices. 3. Educate families about ASD and available resources. 4. Addresses comorbidities like sleep disorders or ADHD. Treatment. 1. Non-medical interventions. Early intensive behavioral intervention. 2. Play-based therapy. 3. Pharmacotherapy, risperidone and aripiprazole for irritability. 4. SSRI for anxiety or depression. 5. Stimulants for ADHD symptoms. Psychosocial medicine. 1. Family-centered care. Focus on supporting the entire family system. 2. Community integration. Encouraging social inclusion through adaptive programs. 3. Mental health support. Therapy for stress, anxiety and caregiver burden. Prevention. While ASD cannot be fully prevented, certain steps can reduce risk. 1. Prenatal care, adequate nutrition, avoiding harmful substances and managing maternal health conditions. 2. Genetic counseling for families with a history of ASD or genetic syndromes. 3. Early intervention, screening and addressing developmental delays promptly. In conclusion, ASD is a lifelong condition that affects individuals and families profoundly. Despite its challenges, early intervention, comprehensive management, and support can significantly improve quality of life. With growing awareness and research, the outlook for individuals with ASD continues to improve, fostering their inclusion and success in society. Thank you. Have a nice day.